Hello, everyone, and welcome to the UNSHAME Kentucky May webinar, How Harm Reduction Helps. My name is Michelle Juma, Project Management Specialist at Shatterproof, and today we have a fantastic 60-minute presentation for you. Please feel free to use the chat box to introduce yourself with your name, organization, or city. As we get started, I'll start with some general housekeeping. The event will be recorded and made available on the UNSHAME Kentucky website. All attendees will be muted throughout the session, but please feel free to use the chat box for any common language or conversation. It will not be moderated as closely. Our interpreters will remain spotlighted throughout the session, but if you have any trouble viewing our presenters at any time, I suggest changing your view to either gallery or side-by-side gallery by clicking the view button on the top right corner of your screen. Closed captioning is available, and also by selecting the bottom corner of your screen on the right-hand side. The UNSHAME Kentucky webinar is brought to you through partnership of Kentucky Opioid Response Effort and Shatterproof. I'd like to give a special shout out to the Kentucky Office of Vocational Rehabilitation for providing ASL interpreting services for this event and all future events in the UNSHAME Kentucky campaign. Our agenda will include a brief overview of UNSHAME Kentucky before we invite our speaker forward to talk about how harm reduction helps. And then we'll open up for Q&A. Please feel free to submit any questions throughout the session and we'll read them aloud. I'd now like to bring forward Marissa Williams to introduce the campaign.
Thank you, Michelle. Like Michelle mentioned, UNSHAME Kentucky is who's presenting this webinar. UNSHAME is a 12-month long addiction stigma reduction campaign that began in March of this year. It's a partnership between Shatterproof and the Kentucky Opioid Response Effort, or CORE, and it's supported by a grant from SAMHSA. So just going over some goals of our campaign, we really have three main objectives. The first is increasing knowledge about OUD. And that recovery is not only possible, but probable with the proper support from community members, family, and friends. The second is to improve attitudes towards those living with or in recovery from OUD. And finally, we hope to develop Kentuckians' understanding of the disease so people can do better and support loved ones and community members with OUD. So our evidence-based approach is based on three main pillars: community connection, story sharing, and education. So starting with community connection, we spent the first 3 months prior to the campaign meeting with community-based organizations across the state to help inform our strategy of how we would reach Kentuckians from all across the state. So far, we have 56 different community-based organizations that are considered partners in our campaign. Also, we have 8 community impact committee members, and those individuals are representatives of their different communities, have different backgrounds, and are from different places in Kentucky. We had our first quarterly meeting on Monday, and they really helped us with understanding if the stories that we're sharing of people in recovery are valuable and what we can improve on in the stories that we share and our story collection process. So speaking of story sharing, our next pillar is collecting stories of people in recovery, friends and family of those individuals or those that may have been lost to overdose, as well as a few stories of providers of folks in recovery or treatment services. We found that collecting and sharing these stories back into the community really helps create a connection of those that are most impacted by OUD, connect with folks that, you know, may not have that direct impact with a person that has OUD. Our final pillar of the initiative is education, which is why all of you are here today. We leverage the community-based organization networks that we have to spread anti-stigma messaging on social media and within their community, as well as encourage folks to attend webinars and increase their own knowledge on OUD. And then we also use social media to target priority stakeholders, priority community members throughout the state. We have an upcoming event. This is the Stigma of Addiction Summit. It will be on June 8th. Michelle is going to drop a link in the chat for more details for folks that would like to attend this event. So registration is live. It's a free half-day virtual event focused on understanding, addressing, and eliminating the harmful impacts of stigma on those who experience addiction. So feel free to take a look at the chat to register for that event. So moving into why you're all here, this is our How Harm Reduction Helps webinar. We are so thankful that all of you decided to join us, and we're so excited for Jennifer Twyman to be our primary presenter. So Jennifer is a health education specialist with the Louisville Metro Public Health Department and Wellness's Harm Reduction Program, where she connects with, advocates for, and provides direct services to people impacted by substance use. Jennifer's drive and passion are fueled by her own 20-year struggle with substance use and over 12 years of using harm reduction services in her everyday life. Since beginning to work in harm reduction in 2017, Jennifer has advocated for and implemented a monthly harm reduction program manager advisory group, meeting to provide a stigma-free opportunity for conversation, community building, and advocacy. She also co-created and launched Louisville's first harm reduction outreach program, connecting with Louisville's unhoused communities, organized multiple COVID-19 vaccination events, providing wraparound services to this same population, as well as helped launch the LMPHW Harm Reduction Quick Response Team, a program that connects with community members that may have recently experienced an overdose. Jennifer is also the recipient of the 2022 Paul Mason Award from the Kentucky Public Health Association for her work with Louisville's underserved community members. Jennifer is a passionate advocate for using harm reduction practices to provide stigma-free support and services to people using substances and or living in high-risk situations, as well as empowering the community she works with to become partners in their own advocacy for dignity, health, and well-being. Jennifer, I will hand it over to you.
All right, hold on just a second. All right. Sorry, I'm not technologically advanced. Can everybody hear me okay?
Sounds great.
Okay. All right, so, okay, sorry about that. My name's Jennifer Twyman. Thank you for that lovely introduction. So I'm gonna start with how I got here. And this is really kind of weird because I can't see myself at all. So I don't know what my screen looks like. So as you can tell, I'm really nervous. Public speaking is something that makes me really uncomfortable. And I'm going to go ahead and put all this out there. My mother is supposed to be watching. Sorry. And I'll probably cry several times today, but this is the first time that she's watched me live. I wouldn't be here without her. So that just puts some added nervousness in me, but I'm really proud to represent. So I'm glad you're here, Mom. Okay, so yeah, I have 20 years of chaotic substance use in my history. I struggled for a long time, and that is really the reason that I do this. The stigma and shame that comes with using substances because of what we are historically taught has effects on us that people don't understand. It is sometimes overwhelming and immense and really hard to dig out of. So after struggling for a really long time and having all kinds of chaotic things happen, I got to a point in my life where I knew that I needed to do something different, and I got the guts to reach out for help. And my mother and my now husband are the ones that were there all the time for me. I talk to parents a lot these days, and one of the things that I try to tell them is the love of a parent is something that is indescribable and can be a form of support that is like no other. I am grateful for the support that I've had to get me to where I am. And again, okay, sorry, I'll keep crying. After my struggle, well, not after my struggle, but toward the end of my struggle, I started on Suboxone, which I was on for 3.5 years. And that is medication-assisted treatment. And I have good and bad things to say about it. I may talk a little bit more about that later, but I wouldn't be here without it. And it works for lots of people. So that is just one form of harm reduction that we'll talk about. I went back to school, and in my last semester, I needed to do an internship, and that's how I got here, essentially. I started working on the mobile syringe exchange part-time with a lovely human being, Donald Davis, who taught me a lot of what I know. I'm forever grateful to him also. And I moved from the mobile unit to the health department, where I've been for 4 years full-time. I love my job. I am very lucky to be able to do something that feeds my soul the way that it does. Having this job is the reason that I am not still out there. I have no doubt about that. Another reason that I am in this spot is I have a sister who just served out 18 years in prison. And the struggle that I have seen her go through, I met her when she was 11, and the struggle is she is set up to fail every turn she makes. And if you don't have a support system, and I'm going to be really honest here, if you don't have the support system that I had as a now middle-aged white woman living in Louisville, Kentucky, then you may not have the same thing happens to you. It's a bad, hard place to be when you don't have any support services. So this is also for her. And then it's also for all of the people that I have met since I have started working here. We have some amazing people in our city and all over the country that use substances and are disregarded, it ignored and shamed and stigmatized and judged for the coping mechanism that they have at that point in their life. So that's how we got here. And I know that's kind of really short, and there's way more to it, but the other stuff is more important than how I got here. So this slide is, everybody knows about the Maslow's hierarchy of needs. And I kind of played with it a little bit because when you have substances involved, the bottom part of that pyramid is taken up a whole lot by just surviving. I used to have that as being not in withdrawal, and it's not just that, because that is certainly not the only struggle there. It is another dear friend of mine, I use her name all the time, her name's Dory, said to me one time that it is fight or flight or fight, that she is literally fighting for her life every day. And that's a hard thing to carry every day. Historically, we've all been taught to say no to drugs and that drugs make you bad. And that's not true. Drugs do lots of good things. And they're not going anywhere. People have been using substances to change and alter their mind for years, and they're not going to stop. It is going to be here. So with that in mind, what harm reduction does is look at that fact and take that. If they're going to be here, then we need to make sure that people that are using them can use them as safely and with as much knowledge as possible. That's just a basic kind of thing to me. The hierarchy of needs, when you look at shelter and all the physical needs and safety needs and social belonging and the self-actualization, all of that, when you're literally struggling for your daily life, is you don't have time or opportunity or the wherewithal or the pure energy to even think about those things. And the stigma, again, I'm going to talk about that a lot, the stigma and judgment that comes with substance use, as well as many other things, but it's life altering. It causes so many disconnections. And one of the things that I have found in my experiences is that a lot of this has to do with disconnection. People that use substances are often self-medicating and treating trauma the only ways that they know how in their circumstances. If we make it safer for people to talk about, then people aren't using in the shadows, which is where people are dying. When you can't talk about what's going on, you hide it. And that's a really scary place to be. The weight, like I said, the weight of stigma and judgment is immense and sometimes not bearable. And so we seek for ways to escape that. And trauma in our lives, I speak for myself, but most of the people that I come in contact with regularly have suffered some unmentionable traumas and are literally dealing with them the only way that they know how. And lots of people disagree with those, but we are all human beings. And that's another thing that harm reduction is about, is really seeing the person and not whatever the issue is. That gets lost along the way. So harm reduction, I'm not going to read this whole slide or anything. I'm pretty confident that everybody can do that, and it's all being recorded in the slides. I'm sure it'll be available later. But this is just a basic definition of what harm reduction is. And we're going to talk a lot about that on this slide also. So harm reduction accepts, this is what I was just talking about, for better or for worse, that drugs are here, and that minimizing the harmful effects is the way that we should go forward, or can make positive effects in the future. I'm sorry, I'm stumbling on my words. And I should have said that up front. That happens for a little bit and I'll get used to it. My nerves will come down a little bit. Harm reduction understands that drug use is complex and multifaceted and is not the same for everybody. What worked for me doesn't work for other people. and what works for someone else doesn't work for me. Meetings and the 12-step program didn't work for me. I really struggled with some issues with that. But I still got, I was able to get some good knowledge from there and some different ways of thinking about things, but the whole program didn't work for me. So being able to piecemeal things together that did work for me as I figured out my process is, I have no doubt, the reason that I am where I am doing what I'm doing and not still in that chaotic life. I really know that being able to talk about this and share my experience and hopefully educate other people about different ways to approach substance use and mental health and our unhoused community members and previously incarcerated people. All of this plays into this. Is not just about substance use. This is harm reduction can be used in your everyday life. And we'll talk about that too, because we all use harm reduction. We just don't call it that. So let's see. We also call for non-judgmental. We don't pressure people into doing anything. I firmly believe that when we give people the information, the tools, and the ability themselves to advocate for themselves and have a part in their own process and own decision-making, then we set people up for success. Instead of telling people what they should do, stigmatizing them, judging them, punishing them, taking things away from them when they admit their use or talk about it, only keeps people in those shadows, which is where people are dying. So harm reduction also ensures that we keep those people at the forefront and that they are experts. People that are using substances right now know what the problems are. They know what issues need to be addressed, and we don't go to them for information, and that is a huge gap that we are missing. Again, with the stigma and judgment, people just get pushed aside, and because they use substances, they don't have the ability to make their own decisions or to be able to advocate for themselves or be able to make a healthy decision. And so when we give that back to people, it sets them up to succeed. Harm reduction focuses a lot of times on just any positive change. If I can get someone to smoke some instead of injecting so many times a day, to me, that's a win. That's a huge win. Having a conversation with somebody who's never openly talked about their use is harm reduction. That is a positive step forward. When we do the opposite and punish and put people in jail for things they shouldn't be in jail for, then we perpetuate the problem and keep that stigma and judgment going, and continue on the path that we are on right now. This is some of this is repetitive about what we were just talking about, but I wanted to make sure that we talked about actual language. Addict, junkie, drug user, all of those things are describing a behavior and only looking at that part. We're not looking at the whole human. And this is that's what we're talking about. We're talking about people. I try to tell our people every day that it's easy for people to dismiss you and walk past you or not listen to you because of the stigma and judgment that we have provided our whole society with and the way that our system is set up. But when we change those things and when we have conversations with the people that we're talking about, things change. Things change in us because it's a different thing to have a conversation with someone instead of, let's just use an example of as being an EMS person who might respond to an overdose. So that's a different situation than if you're coming in the syringe exchange to shadow and see what our program is like, and you hear conversations. It's not in that chaotic, very risky, life-threatening situation, which can be really chaotic and uncomfortable for everybody involved. But when we change that framework of how we look at it, and that's a person that we're talking about and not the behavior of that person, then when we start to go forward, we see that person as a whole person and not the harm that they're doing to themselves and not what we think they should be doing. Because again, our people know best what works for them and how to stay healthy. We just don't, I think and again, these are all my opinions, we don't give them the ability to be able to take care of themselves. We don't give them the tools, the education, the support, and literal ability to be able to do a better job at caring for themselves. So that goes over a whole lot about what harm reduction is and why it works. We make space for people to talk about all of this so that it's not hidden. And again, connection is just a huge thing. When you can't talk about something that is a struggle in your daily life, you feel really disconnected to everything. And it's really hard to get out of that. And when you don't have community around you that understands and is empathetic and sympathetic and works with you, it sometimes can be an absolute no-win situation. We value our people and the expertise that they bring to the table. Again, they can bring information to us, and the more information we give to people that use our harm reduction programs and that we talk to every day, the better off we as a whole society will be. Harm reduction is rooted in evidence-based practices. So none of the things that I'm going to talk about today are just willy-nilly right off, never been done before. They're all proven to work. The problem seems to be, to me, is that in our heads, they're not what we've been taught historically should work. And again, there's that word should. But again, we're not going to the people that all of these policies and rules and laws are affecting to get input back. We're just making them arbitrarily about things that, frankly, lots of the people that are making the policies and rules don't know anything about and don't have any lived experience in. And that again is not setting anybody up for success. Harm reduction keeps people engaged, even if they re-engage in high-risk behavior. Lots of people in the substance use world use the word relapse. I don't particularly care for that word. You'll see I don't use a whole lot of those words. I don't say that I'm in recovery. I don't need to recover from anything. I'm in a process for sure. And right now I've figured out that process, but it's a daily, constant thing that I have to pay attention to, but it's good paying attention. It's not a critical, sorry, I also cuss a lot, I'm a piece of shit kind of thing. I literally try and value my own advocacy, and I'm not very good at it a lot of the time, but I'm better than I used to be. So when that relapse and that kind of stuff comes in, we keep people engaged. It doesn't make me not support people. It probably reinvests me even more to know that there's more of a process, that we need to walk with people through that process, not expect them to be able to figure it out on their own, because it's not an easy thing to figure out on your own at all. And often it's not possible. So again, we set people up for success when we involve them and make their voice heard. And it is an important voice to be heard. So these are just some basic, easy examples of harm reduction. We got birth control, total harm reduction. COVID vaccines, obvious harm reduction. Seat belts, speed limits. Down here, harm reduction programs, safe supplies. That's anything from Narcan to programs like the Syringe Services Program, to overdose prevention centers, which I'll talk about in a little bit, to drug checking, providing our people with sharps containers so that they can safely dispose of their syringes and their needles. Housing is harm reduction. Housing is healthcare. Healthcare is harm reduction. All of that is harm reduction. So we can just, people recently in the media there have been negative things used in relation to harm reduction in terms of crack pipes, and safe smoking is what that is. And that is another form of harm reduction, when we give people tools to safely use substances, because syringe exchange is a valuable, awesome program. It's not, injecting is not the only way people use substances. There are other ways we can keep people safe. So by providing pipes so that people are not sharing, by providing straws so that people are not sharing those, because all the communicable diseases that can be spread through sharing syringes can be spread through sharing pipes and sharing straws, anything like that. So anything that we can do to keep people safe while they use is what we are about. So what we're not about is we don't mean harm, that anything goes. That doesn't mean go use all the drugs you want to use and it's all free for all. That's not what we do. We do not enable drug use. We make sure that people that are using safely. We don't condone, endorse, or encourage drug use. All that's pretty repetitive, but people like to word it differently. And we also don't exclude any other form of treatment out there. So 12-step programs, they're not excluded. They're just part of what I think should be a menu of services that are available for people to see if it works for them. Again, when we involve people in their own decisions about their own lives, we go in only forward ways and positive ways. So here's a little, this has all been in the news, and I won't read all of this, but 107,000 people died from preventable, that's the thing that's left out of that sentence, preventable drug overdoses. Every single one of them, in my opinion, is a policy failure. And that's our failure, not the person that overdosed. It is, we can change things to prevent all of those. Again, I'm not going to read all of this. Fentanyl, the occurrence of fentanyl being in overdoses has skyrocketed. I believe it was 23%. It takes, I'm sorry, I'll take a breath. 2/3 of the overdoses involved some type of fentanyl. So that is a huge problem, and penalizing fentanyl more is not the solution. When we increase penalties around classification of, let's use fentanyl as a perfect example. When we increase penalties for that, that also means we're saying that, so I'm going to give you an example. They changed the law, the trafficking law, that if you share any amount of heroin or fentanyl, you can be charged with trafficking. So there is a minimum mandatory sentence for trafficking. So if you've gotten charged with trafficking because you shared your heroin that had fentanyl in it with your friend, and now you're charged with trafficking, that's a minimum sentence. Not helpful when a good portion of the people who happen to sell drugs also use their supply or use some type of substance. So again, when we penalize and put people in jail, we're not going forward. We're not moving in a positive direction. We are just keeping people in prison and costing more money and causing more stigma and judgment. Kentucky numbers. Our numbers are not good. The overdose deaths have just been, I don't know what to say. I've lost too many friends in the past several years. People that I considered very special to me. And again, all failures on our part. Okay, again, I'm not going to go into a whole bunch of depth about this because the other things are what I want to focus on in the positive. But just know that I'm not okay with this. These are not okay numbers to me, and especially when there are things that we can do easily going forward that can prevent a lot of this. Kentucky has more syringe exchange programs than any other state in the country. And that's a good thing. However, there are some negatives to that. All of the syringe exchange programs in Kentucky have to be run through the health department. And that's a government agency, so that can cause a barrier right there for people. It also, if in Kentucky, if you take federal money for your syringe exchange, there are requirements that you have to meet. And a lot of the syringe exchanges in Kentucky are considered 1-for-1 exchanges instead of needs-based. Louisville Metro's syringe service program is a needs-based syringe program, so we can give out much more than the other programs can. And again, those are barriers to accessing our services, as well as the hours that they're open, the supplies that they're allowed to give out. Even though they're awesome programs, and I'm proud to say that our state has more than any other state, they are still, we as a state are still not approaching it in the right way and breaking down barriers like we should. With COVID, I will say this, COVID changed a whole lot of things in our syringe exchange. We had to actually change locations for a while and took down a lot of what provided some privacy for conversations. So a lot of it, especially during COVID, became kind of an assembly line where we wanted people in the door we wanted them inside as little as possible. And that has unfortunately had a very negative effect on a program that is based on connecting with people. And we're trying to work back towards that, but I know that is the case in lots of syringe exchanges, that it's very, let's get you in here, get you what you need, and let's get you back out. Instead of, can we talk about how you're using? Can we talk about if you're using a new syringe every single time? Can we talk about if you're having safe sex? All of these conversations are giving people information and keeping people engaged in their own health. And we as people that use substances often don't take that into consideration. And a lot of that goes back to that stigma and judgment that we carry around with us, that we don't think we're worthy of being taken care of in a good way. And that's again, that all goes back to that shame and stigma, and we can get past that if we just if we change the way that we approach people and look at substance use. So Louisville, this is numbers on our program specifically. Since we opened in June, we have our 7-year anniversary this summer. We've seen over, you can see the numbers, we've seen over 23,000 individual people with over 200,000 visits. Our return rate, I think, is phenomenal. We've given out over 11 million new needles and had over 8 million returned. Since we began giving Narcan out, and that's not the whole 7 years by any means, we've given out over 31,000 in just the syringe exchange alone. So when we give out Narcan in the syringe exchange, we also ask if the previous one that they got was used to reverse an overdose. So of the ones that we've given out through the syringe exchange, which is about almost 21,000, almost 9,000 of those we know have been used to reverse an overdose. We've given out over 12,000 fentanyl test strips. I began when COVID shut everything down, we began doing outreach. So that was in essentially since the January of, oh, my years are all messed up with COVID now, 19 or 20, I guess. So I have personally done outreach with about 1,000 people and provided 137,000 new needles and returned over 90,000. And that is proof that taking harm reduction, one of the things about harm reduction that I didn't mention earlier is that we meet people where they are. And that is in that literal sense. We meet people where they are in their life, in their process, in their chaos, and in their struggle, but also literally where they are sometimes. I go do outreach in the encampments. I do outreach with unstably housed people in Louisville. The more people we can meet, the better everyone will be. This takes care of the whole city. It takes care of the whole community. It just going forward is just it's the way to make a positive change. I don't have any doubt about that. We're going to talk about, I'm going to now talk about just a few of the things that do work. But first I want to say that I've got a few bullet points here that I just want to make because I'll forget something. Changing the conversation, which is what I hope I'm doing right now, is in the forefront of what we need to do. We have to talk about this differently so that people feel safe to talk about it themselves. We need to support and not punish. We need to break down the barriers. We need to not have requirements such as that you need to stop using before you can come into housing. That makes no sense to me. When people are unhoused, asking them to stop their use, which is one of their coping mechanisms, asking them to do that before they come indoors is an impossible ask most of the time. It just doesn't work that way. We need to move towards, this makes people really uncomfortable, but we need to move towards decriminalization. Again, punishing people in the way that increasing the punishments for fentanyl or trafficking, increasing all of those is putting people in cages instead of looking at the person and seeing how we can help. How can I meet you to do something different, the next step? That is how we need to approach all of this. We need more affordable housing with no barriers. And we need to remember that we're talking about human beings, amazing human beings that have worth and expertise and amazing skills and so much to give that they don't have anywhere for that outlet. They don't have the opportunity to be worth what I know that they are and what they are told often that they're not. Okay, so those were my big bullet points. But now I'm just gonna go over a few, I'm trying to keep track of time. Oh Lord, I've talked way longer. Okay, so this overdose prevention site, most important. Our New York City just opened 2 of these since the first of the year. They are places where people can take their own supply and use in a safe environment. There are medical professionals there. I'll say this, in the whole world, there are many, many overdose prevention centers in the whole world, and no one has ever died of an overdose at an overdose prevention center or a safe injection site or whatever words you want to use to describe them. And again, I'll say that again, no one has ever died from an overdose at an overdose prevention center. That is clear evidence that programs like those work. They also have drug testing abilities so that people can test their drugs before they use, which again is another form of harm reduction and making sure people have information about the substances that they're using. Since New York City opened theirs, you can see the numbers. That's amazing, way above what the city thought that they were going to see. It's amazing success. So we need to, I also included a YouTube video that is like 13 minutes long. It's an amazing video and just really talks about the program and explains what services they have. They connect people to all kinds of services. Fentanyl test strips, we are able to distribute those at the health department. They are ways people can check their substances, drug checking kits. These should all be available, readily available to any community member that needs them. If anybody wants them in Louisville, they can always contact me. I can hook you up with whatever you need. We should be having drug checking kits and fentanyl test strips and Narcan at every music festival in this city. We have a big one this weekend and we're not there when we should be. And that's a huge gap. That's a excellent way to educate people about how to talk about this differently and to give people information. Safe supply options. So MAT, the Suboxone that I was on is considered an opioid agonist therapy. There's also in Canada, they have actual heroin replacement programs. So instead of using an unsafe supply on the streets, they are provided with medically safe heroin, and they they take it just like regular medication. That's what works. Same with stimulant substitution. Lots of people out here are treating their own ADHD by using methamphetamine because nobody will give them the correct dosages and things that work for them. Community managed alcohol programs, same thing. Withdrawal from alcohol can be deadly. Providing people with safe ways to use and the support systems to really surround them so that they are using safely is again, the way we go forward in a positive way. Housing options. Louisville just opened their first safe outdoor space. Amazing opportunity. If we can make that work, that's freaking phenomenal. I'm so excited about it. Portland Hotel Society in Canada also has amazing options for housing. I included all of this on the last page with all the references and stuff, so anybody can go and look. Portland Hotel Society is an amazing program. They have all kinds of no barrier housing and treatment facilities, overdose prevention facilities. And last, this is, again, changing the conversation, involving the people that we're talking about in every decision that we make. One of the things that is my favorite part of my job are the meetings that I get to have once a month, that is just really trying to build power in the people that I meet every day that feel like they don't have any power and any say in anything. Again, setting people up for success involves having conversations and involving them in their own life decisions. Being able to be a part of the process with my husband and trying to figure all of this out in my life, again, is one of the main reasons that I'm here, because he didn't tell me what I had to do. My mother didn't say it's either this or we're done. I can't do this anymore. That wasn't ever an option. And so if we can surround our people with services, support, understanding, empathy, love, connection, if we can do that, we can go forward in this this war on drugs that they've been doing for years and years that clearly doesn't work. We've got things in front of us that do work and are evidence-based and that are exciting and have the possibility to do amazing things. I think that educating people that want to know more about harm reduction, like programs like webinars like these, and me making myself uncomfortable, because this is one of the most uncomfortable things that I do. But because I'm asking other people, the people that I work with, the people that use substances, other community members, to have uncomfortable conversations, then I have to do it too. And so that's why I'm here. I think I've taken up almost all of my time. Here's this slide. I think it's question time. It's like 10 till. Am I right about that?
Yeah. Thank you so much for your presentation, Jennifer. And thank you for being so open and sharing your own story. Really, really appreciate that. But yes, we are opening the floor for question and answers from Jennifer. Please submit those in the Q&A section of Zoom. They can be anonymous if you choose to be that way, or you can put it in the chat and Michelle will be monitoring that as well. So Jennifer, one question that we have is, you talked about the substantial harm that criminalization causes for people who are arrested and incarcerated. What impact do you see criminalizing having on the increasingly unsafe illicit drug supply?
Mhm. That again, that is those are all they're all connected. When we increase penalties for fentanyl, put more people in jail, we are continuing to stigmatize. We repeat the whole question again, because there's something in there that triggered something and I've lost it.
Yeah, sure. You
Sorry.
talked about the substantial harm that criminalization causes for people who are arrested and incarcerated. What impact do you see that having on the increasingly unsafe illicit drug supply?
Okay, sorry. So a direct relation to the increasingly dangerous drug supply. So in part of my job when I'm following up on overdoses, I'm not just seeing people that are using heroin. I am coming in contact with young people that thought they were using Molly, which is the drug that lots of people use when they go to big festivals and raves. I've had people tell me they thought they were using cocaine. I had people tell me that they thought they were taking a Xanax bar. So there's all kinds of counterfeit pills in Louisville and in Kentucky and all over the country because of the criminalization and increased punishment for trafficking and for fentanyl. So it's only doing negative instead of what they think it's going to do, which is cut down on the quote unquote dealers and people that use substances, when that's clearly not what works. With prohibition, years ago, what happened when they stopped making safe alcohol? People started making their own alcohol and it was not safe. So the same thing happens now. The supply is completely tainted. And when we, again, the Canada has amazing programs that provide safe supply. That's when we give people safe ways to use, they do. It's just that we don't often give them the tools or the ability to use safely. I think I answered that.
Yes, I think you did too. So I lost my mute button for a second. Another question we have is, what can rural communities do to better serve people in need when they may not have the resources to do so?
That's an excellent question, and I really wish I had a good answer. I think that again, some of that has to start with changing the conversation. And that may be just starting with the basics, like trying to push policy and educate people in the in the local health department about these programs. There's all kinds of information you can get about evidence-based, studies that have been done about the success. Let's see, one statistic that always sticks in my head is that people that use harm reduction programs like syringe services programs are 5 times more likely than those that don't to access services. So when we give people a safe place to talk about it, they do. So, I guess in a rural where you don't have services, I think one option is if you can, I don't know if people can do this or not, but like having meetings where people can safely talk about it. It really gives, having that space and giving people a voice to talk about their struggles is it's a game changer, really. And so, and then also talking to, if you can find somebody who's like-minded, like in the fire department and EMS or on local police department, if that's an option. Really just trying to find other like-minded people to build some power in your conversation and just start talking about it. I think that one of the things that we need to do in Louisville ourselves is have a big community education campaign. We need to talk about this differently. We need to, I wear lots of t-shirts that say, I love someone who uses drugs. Or be nice to drug users, and it gets people's attention. It changes the way you think about it. And that can just that little switch is sometimes all somebody needs to get to that other spot, away from the punishment and stigma and more towards the support and services.
Thank you. The next question, I don't fully understand it, but maybe if I say it, you will. Um, where in Louisville can one receive ADHD assistance?
That's also a very good question. So well, it depends. It depends on if that person has a history of substance use. Unfortunately, that comes with the stigma and judgment. If you have a history of substance use, I don't know of any doctors that are going to prescribe you the normal ADHD medicines. Mine won't. That's a problem. Just because I have a history of chaotic substance use doesn't mean that I don't still have issues that need to be medicated. Just like when I have surgery, that doesn't mean because I had a 20-year struggle with opiate use, doesn't mean that I don't get pain medicine. And lots of people think that that's what it means, that you have to be totally abstinent for the rest of your life, to the detriment of your health sometimes, which is ridiculous.
I'm going to jump in here. So we are at 1:57, and although there's a few other questions we could get to, I want to make sure that we share out a few resources to our attendees before we hit 2 p.m. I'm sharing my screen now, and there are a list of really great harm reduction resources that Jennifer's office had supplied to us. This will also be PDF'd and shared in any post-event correspondences, but want folks to know that they are available for you to find out more information and get involved in any of this sort of work happening in your community. I want to thank Jennifer so very much for being a part of our presentation today. I'm seeing a lot of activity in the chat who appreciate you for sharing your story, for the role that your mom has played. Hello to mom out there, and how so many people really feel like that connection is what makes the difference. Having the support network around you, and getting that family stigma to better understand how you do need support and how you can access these services. Before we close out, I'll just shout out our Stigma of Addiction Summit one more time. The registration link is available on screen and also in the chat. But I'd also like to invite all of our attendees for today's event to our June webinar, where we'll be talking about improving opioid use disorder treatment for LGBTQ+ communities. Celebrating Pride Month, but also recognizing how we can create safe spaces, increase retention within harm reduction or in recovery programs, and be able to invite everyone to this conversation and celebrate their own experiences and journey.
I do want to just say, if anybody wants information from me or anything, please feel free to reach out to me anytime, always.
All right, thank you so much. We will start signing off. I'll keep the chat going if folks want to send any last messages, but appreciate you all for coming out and our speaker for participating today. Have a great evening.
Thank you, everybody.